So everyone, again from the Faculty of Health, Joel Alcantara, who's presenting on a literature review on the chiropractic care of pregnant women. Over to you, Joel.
Okay, thank you. Good morning, everyone. And again, thank you for attending my presentation. To begin, I'd like to thank the SCPA committee for giving me the opportunity to present our scoping review on the chiropractic care of pregnant women. And of course, I also want to acknowledge my supervisors, Professor Stephen Myers, Dr. Elizabeth Emanuel, and Professor Santa Grace, and the computer scientist for this scoping review, Ryan Wetton from Boise State University. And of course, I want to acknowledge the funders of my PhD program, the International Chiropractic Pediatric Association and Southern Cross University. Next slide, please. So as you can already tell, the main interest in my research is the chiropractic care of pregnant women. We know from the literature that women more than men use alternative therapies, or commonly referred to as complementary and alternative medicine. But when it comes to, next slide. There we go. But when it comes to perinatal care, according to Barnes and colleagues, pregnant women and women in the postpartum period utilize alternative therapies to protect themselves and their babies from harm and to facilitate the normal physiological processes of pregnancy, birth, and lactation. When it comes to pregnancy care, Bowman and her colleagues found that women use alternative therapies as a means of supporting their sense of self-determination, to pursue a natural and safe childbirth, and because the women have a close affiliation with the philosophical underpinnings of the alternative therapy they're using. Next slide. So chiropractors have a long history of attending to the care of pregnant women. Actually, it goes all the way back to chiropractic's inception in the late 1890s. And in the last 20 years, we've seen a surge in interest in the use of chiropractic services among pregnant women and women in the postpartum period. This isn't surprising, given that chiropractic resonates with the needs and wants of pregnant women in terms of receiving relief for their pregnancy-related musculoskeletal complaints, such as low back pain, pelvic girdle pain, and it supports their need for an alternative, safe, and natural childbirth. Chiropractic is also patient-centered care that incorporates the principles of vitalism, holism, and humanism. And despite this interest or use of chiropractic services for pregnant women, to date, there is no assessment or consolidation of the peer-reviewed literature in terms of its totality in the scientific literature. So to address this deficit, we performed a scoping review to identify the types and sources of the literature, the themes and concepts of the existing literature, and identify gaps and deficits in the subject matter. Next, please. So in terms of our methods, we perform or followed the PRISMA scoping review guidelines, which is a 4-step process. Step 1, as with any research endeavor, begins with the research questions. We asked ourselves, what are the aims and the purposes and the types and sources of the literature? What are the patterns or themes of the reviewed manuscripts? And what are the gaps and